So I'm going to talk about the classic tap plane block, a transverse abdominis plane block for lower abdominal post-surgical pain or chronic post-surgical pain, post-cesarean section pain. To perform this procedure, you will start scanning at the midline, looking at the rectus muscle, moving the ultrasound probe laterally and looking for the other muscles of the abdomen, which includes transverse abdominis, external oblique, and the internal oblique. So here we have all three muscle layers of the abdomen: the external oblique, the internal oblique, which is a thicker layer, and the transverse abdominis. And the plane between the internal oblique and the transverse abdominis, this plane is your plane of interest where you would inject the local anesthetic and steroid mixture for chronic abdominal pain management. This will provide you analgesia only for the muscle and the muscle plane. So it will only provide you with a somatic analgesia to perform, to get the benefit of both somatic as well as visceral analgesia. You will have to move the probe posteriorly, looking for a quadratus lumborum muscle where all these muscles start to taper. So this is a tapering of the transverse abdominis muscle, and you have internal oblique muscle and the external oblique muscle. And at the tapering of the transverse abdominis muscle, there's another muscle that comes in. The view is the quadratus lumborum muscle, and there have been described approaches: quadratus lumborum 1, quadratus lumborum 2, and transmuscular quadratus lumborum block, which could provide you with visceral analgesia as well as somatic analgesia. So I'm going to talk about the subcostal tap plane block. The subcostal tap plane block for chronic pain is useful when you have patients who've had post-cholecystectomy pain syndrome, or they've had an abdominal surgery and they have a chronic post-surgical pain syndrome. You could use this for abdominal myofascial pain syndrome as well. To perform the subcostal tap block, the structure you will start to scan this would be the midline, looking for the rectus muscle. I call this as a bow tie sign, where you have a rectus muscle seen here on the screen, and it looks like a bow tie. You have a rectus sheath below the rectus muscle, and this is a linea alba. This is your starting point of scanning. Once you've scanned this structure, you will move your ultrasound probe laterally, looking at the rectus muscle, and you also see the vasculature and the peritoneum. Once you're moved more laterally, the first muscle that comes under the rectus muscle is the transverse abdominis muscle, which I'll show you on this scan. This is the transverse abdominis muscle that's coming below the rectus muscle. Another muscle that's starting here is the internal oblique, and you have a rectus muscle along with the rectus sheath. Once you have seen this, you will start to scan more laterally, looking for another muscle that's appearing in the scan, which will be your external oblique. So starting point, a bow tie sign with the rectus muscle along with the rectus sheath, moving the probe laterally, looking for the first muscle that's starting below the rectus muscle, the transverse abdominis, moving more laterally, looking for the internal oblique, and then you have another muscle coming in the view, which is the external oblique. So you have all the three abdominal muscles that are shown in this picture: external oblique, thicker one, the internal oblique, and the transverse abdominis. And the tap plane would be the plane between the internal oblique and the transverse abdominis. So this is the plane, this is the area of interest. You'll bring the needle in plane, going into that and injecting about 15 cc's to 20 cc's of local anesthetic and steroid mixture. To perform this block, the needling will be in plane. You will use a 10 to 15 centimeter length needle based on the body habitus of the patient, bringing the needle in plane. You can also put in a catheter in this plane and continue the infusion if the patient's having the abdominal surgery. Thank you.